Understanding Chronic Fatigue Syndrome, a comprehensive guide. Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis, ME, is a complex and often misunderstood medical condition that affects millions of people worldwide. In this comprehensive guide, we will delve deeply into the understanding, origin, classification, and dangerous consequences of CFS. Our aim is to provide you with a wealth of information that not only educates but also helps you gain valuable insights into this debilitating illness. Learn more about managing CFS, enroll in our course. Understanding Chronic Fatigue Syndrome. Chronic fatigue syndrome is characterized by persistent and unexplained fatigue that lasts for 6 months or more. And it cannot be attributed to any underlying medical condition. This profound fatigue is not alleviated by rest and significantly interferes with a person's daily life and activities. It's important to note that CFS is a clinical diagnosis, meaning there are no specific laboratory tests to confirm its presence. Diagnosis is based on the patient's medical history, symptoms, and the exclusion of other potential causes of fatigue. The origin of chronic fatigue syndrome. While the exact cause of CFS remains a subject of ongoing research, several factors have been proposed as potential triggers. These include viral infections, immune system dysfunction, hormonal imbalances, and genetic predisposition. It is believed that CFS may develop following an acute illness or severe stress, which then leads to a persistent state of exhaustion. Classification of chronic fatigue syndrome. CFS is a highly heterogeneous condition, meaning it can manifest differently in different individuals. To better understand and manage CFS, it has been categorized into several subtypes based on symptom patterns and severity. Some common subtypes include post-exertional malaise, PEM. This subtype is characterized by a worsening of symptoms after physical or mental exertion. Even minimal activity can lead to a significant decline in energy levels. Sleep disturbance. Many individuals with CFS experience disrupted sleep patterns, which can exacerbate their fatigue and overall condition. Orthostatic intolerance. Some patients with CFS have difficulty maintaining an upright position, leading to dizziness, lightheadedness, and fainting. Neurological symptoms. CFS can manifest with cognitive difficulties, often referred to as brain fog, as well as headaches and sensory sensitivities. Gastrointestinal issues. Digestive problems such as irritable bowel syndrome, IBS, are commonly associated with CFS. Immune dysfunction. There is evidence to suggest that the immune system plays a role in CFS, as many patients experience recurrent infections and flu-like symptoms. Early warning signs and risk assessment. Recognizing the early warning signs of CFS is crucial for prompt diagnosis and management. Some common signs to watch for include persistent fatigue. If you experience unexplained fatigue lasting for 6 months or longer, it's essential to seek medical evaluation. Post-exertional worsening. Pay attention to how your body responds to physical or mental exertion. If you notice a significant worsening of symptoms after such activities, it could be an early sign of CFS. Sleep problems. Consistent sleep disturbances and poor sleep quality may indicate an underlying issue, including CFS. Cognitive difficulties. If you find yourself struggling with memory, concentration, or brain fog, it's essential to discuss these symptoms with a healthcare provider. Recurrent infections. Frequent infections or flu-like symptoms without an apparent cause should raise concerns and prompt medical assessment. Real-life examples and case studies. To better illustrate the challenges faced by individuals with CFS, let's look at a few case studies. Case study, Emily's journey. Emily T., a dedicated nurse, developed CFS after a severe bout of mononucleosis. Her fatigue was so debilitating that she had to take a leave of absence from work. Emily's journey involved a multidisciplinary approach to her condition. She worked closely with medical professionals, including a CFS specialist, who helped diagnose and manage her symptoms. In addition to medical interventions, Emily made significant lifestyle adjustments, such as adopting a structured sleep routine, managing stress through relaxation techniques, and gradually increasing her activity levels through a pacing strategy. Through this comprehensive approach, Emily gradually regained some of her energy and was able to return to her nursing career part-time. Her journey showcased the importance of a personalized and holistic approach to managing CFS. Case study, Alex's struggles. Alex J., a former athlete, experienced CFS symptoms after a viral infection. His journey was marked by severe post-exertional malaise, limiting his ability to engage in any physical activity. Alex sought help from a specialized CFS clinic, where he received a thorough assessment and tailored treatment plan. One of the key components of Alex's journey was learning to manage his condition through pacing and graded exercise. This involved carefully balancing his physical activity levels to avoid triggering symptoms while gradually rebuilding his fitness. Over time, with the guidance of his healthcare team, Alex regained some level of fitness and improved his quality of life. Success story: David's wellness journey. David M., a teacher and musician, developed CFS during a particularly stressful period in his life. His journey to wellness involved a combination of graded exercise therapy, dietary adjustments, and mindfulness practices. David's determination and commitment to self-care allowed him to maintain a part-time teaching position and continue pursuing his passion for music. Success story: Emma's career rebound. Emma C., a lawyer, faced a career setback due to her CFS symptoms. With the support of her legal firm, she transitioned to a role with flexible hours and remote work options, allowing her to manage her energy levels effectively while still practicing law. Learn more about managing CFS, enroll in our course. Frequently asked questions, FAQ. What is the main symptom of CFS? The primary symptom of CFS is persistent and unexplained fatigue that lasts for 6 months or longer. Is there a definitive test for CFS? CFS is diagnosed clinically, based on a patient's medical history and symptoms. There is no specific laboratory test for CFS. What can trigger the development of CFS? Potential triggers for CFS include viral infections, severe stress, hormonal imbalances, immune system dysfunction, and genetic predisposition. How is CFS treated? Treatment for CFS often involves a multidisciplinary approach, including lifestyle adjustments, cognitive behavioral therapy, graded exercise therapy, and symptom management. Is CFS a lifelong condition? CFS varies in its course and severity. Some individuals experience significant improvement over time, while others may have a more persistent condition. Can children develop CFS? Yes, children and adolescents can develop CFS. It may present differently in younger individuals compared to adults. Is there ongoing research into CFS? Yes, research into the causes and treatment of CFS is ongoing, with the aim of improving our understanding and management of the condition. How can I support a loved one with CFS? Offering emotional support, understanding their limitations, and educating yourself about CFS can be valuable ways to support a loved one living with this condition. Conclusion: chronic fatigue syndrome, CFS, is a challenging and often life-altering condition that affects individuals in various ways. It is crucial to be informed about CFS, its symptoms, management strategies, and available support networks. This comprehensive guide has provided you with a deeper understanding of CFS, its classifications, real-life examples, and success stories. If you or someone you know is living with CFS, remember that you are not alone. Seeking medical guidance and connecting with support communities can make a significant difference in managing this condition. Moreover, to further enhance your knowledge and learn effective strategies for managing CFS, we invite you to enroll in our comprehensive course on CFS management. Enroll in our course on managing chronic fatigue syndrome. We hope that this guide has been informative and has provided you with valuable insights into chronic fatigue syndrome. By raising awareness and offering support, we can improve the lives of those affected by CFS and work towards a brighter and more manageable future for individuals facing this challenging condition. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on